Hi, everyone. Welcome to this talk. Thank you very much for registering and taking an interest in this. This talk is by DIMA, which stands for Diversity in Medical Academia, and it is a student-led group that aims to encourage students, especially from underrepresented groups, to pursue research and academia. To stay in touch or to talk about anything that you're interested in yourself, do reach us out in any of our social medias under DIMA Foundation for Twitter, Instagram, LinkedIn, and Facebook. We'll be more than happy to hear from you. Today, I'm more than delighted to introduce our speaker, Jacob. Now, Dr. Jacob is a medical foundation doctor who has a special interest in leadership and management and has a great contribution towards the systematic levels of health and strengthening, especially having a master's degree in health policy, which he'll be explaining more and giving a bit more insights towards his experience with the different organizations that he's passed on. So I'll keep it and give it to you, Dr. Jacob here, and he'll be better in introducing himself a bit more. And yeah, hope you guys enjoy the event as well.
Wonderful, wonderful. Thank you so much, Adan. Really, really appreciate it. Massive thank you to DIMA and massive thank you to each and every one of you who is here this evening. So I am going to give a very short talk in giving you some more exposure and more insight into health policy, into leadership, into my journey. But before I do that, I'm very keen on some degree of interaction. So if you're able to access your chat bar, it would be great if you could just tell me what stage of training you are in, whether you are second year, whether you are third year, whether you are fourth year, whether you are final year intercalating, whether you're even a junior doctor. So that way I can just pitch accordingly. Fourth year, thank you, Habiba. Okay, and whilst we're finding the chat bar, I will get my presentation up. Okay, so basically what I'm going to be giving to you today is an introduction to health policy and leadership. What I'll do is that I'll keep this portion as brief as possible, simply because I actually can't see the Microsoft Teams anymore. So what I'll do, I'll just make this part of the session as didactic as possible, just speaking, giving you an overview into my journey, and then I'll pause at interims to take questions. And then hopefully what I hope is that, what we could do is that we can record this part and then we can just go into a conversation for the remainder of the session, just to ensure that everyone can get as much out of this as possible. So I'll just talk for this part and then I'll let you know when I've got to the end. But yeah, hopefully you find this interesting. So as it has been said earlier, we are going to give you an introduction to health policy and leadership, and this is courtesy, of DIMA. So if you have watched this show before, this show is called New Amsterdam, and essentially this show is one of my favorite medical shows, and it follows a medical director called Max Goodwin, and it's actually based on a real story of a medical director in a public hospital in America who faces the tension of working as a medical leader, as a clinician who has a lot of clinical expertise and sees patients day in and day out, but is also accountable to the board, providing strategic direction as well as the business administration of the hospital. And it kind of follows the tension that he experiences along with his own personal experiences. So I would really recommend this if you are someone that's interested in what does it look like to think about how a hospital is run. What does it look like to think about the context, the system context of a hospital, rather than simply the patient in front of me. So that's really what I'll be talking to you about in terms of my journey so far as a junior doctor interested in health systems, give you a little bit of insight into health policy, what health policy is, what that looks like, and then give you a little bit of insight into leadership as well, in terms of your leadership journey and how you can kick that, especially if, to my understanding, most of you are undergraduate stage. So hopefully this can prove insightful and helpful for you. So this is a photo of me when I was coming out of the hospital. I'm sure all of you guys can relate to this, when you've just been wearing your mask all day and you just want to take it off. So this is a photo of me after a long shift. I am a junior doctor based in Brighton. I am an academic foundation doctor in leadership and management. There's only 3 places in academic foundation in leadership and management, meaning that essentially that I have clinical competencies that I have to get, as well as academic competencies within the realm of systems and management, within the realms of healthcare leadership and what it looks like to strengthen a hospital in context of a health system. So I'm more than happy to take any questions at the end about academic foundation program, how the application differs from standard foundation program, and just the journey of being an academic foundation program doctor in leadership and management, as opposed to most posts which are more focused on either research or medical education. So really, really happy to take questions on that. So I'll just ask that you just drop your questions, and then, you know, we will have a conversation at the end. And I've had the privilege of working with a number of organizations and institutions during my journey. So far, I've taken a number of lead roles and leadership roles, both at a national and international stage and platform. So just working around this, you know, I did a master's at London School of Economics, as well as London School of Hygiene and Tropical Medicine. I did that master's in health policy planning and financing. And I did that after my 4th year at medical school. I've also worked for NHS England, particularly my local CCG, as a project manager. I was a project manager whilst I was studying for my finals in 4th year, and I was overseeing a £20,000 budget for the region, for the whole Staffordshire region, to increase the adoption of technology-enabled care services. I've also worked as a civil servant as well, particularly with the Human Fertilisation Embryology Authority. I worked in part of the intelligence team, and I was overseeing a research project looking at the use of single embryo transfer to reduce the multiple birth rates. I've also been a scholar with HLA, Healthcare Leadership Academy, which I'm sure many of you have heard about. Once again, very happy to take questions on these different organizations. And with HLA, I was a scholar, and then I went on to chair the most recent international conference where we were looking at health workforce and health policy. I've also worked in an international organization called the International Working Group for Health System Strengthening, which is a group of young public health professionals working closely with Johns Hopkins University, which is a leading institution in America. And I was on the European committee, part of that steering committee for that. Also worked in the BMA as well as Medical Students Committee. I was the deputy chair in my final year. Worked at Christian Medical Fellowship, which is a national charity looking after Christian doctors. I've worked closely looking and reviewing the charity and the governance and seeing our board recruitment. And I'm also the founder and director of the Spiro Medic Support, which is a registered community interest company which operates nationally, supporting socioeconomically disadvantaged students. And we essentially help to support them get into medical school and widen the aspirational, close the aspirational gap. So that's a little bit about me. Once again, feel free to ask me any particular questions about some of these organizations and about my exposure to them. I've worked with others, but that's how many I could kind of fit into the slide. And I hate stuff like this. So I'm going to briefly move on to where we actually focus on you. So what is health policy? This will be the point where I'll pause, but I would say keep it in mind what you think health policy is, and then we'll come back to that. So health policy defines health goals at the international, national, or local level. The international, national, or local level, and specifies the decisions, plans, and actions to be undertaken to achieve these goals. So health policy is a very, very broad concept. It weaves into various different areas. And in terms of plans, decisions, and actions, these have constantly been made on your behalf, and these are constantly being made for your health and about your health. You know, whether it be the vaccination, you know, of young children. Many of you would have probably been vaccinated as babies. You know, you probably didn't consent to that when you was 3 weeks, 6 weeks old, shall I say, you know, but this was part of a massive public health program when you think about the rapid decline of polio, and now only in 2 countries. I believe it's Nigeria and Afghanistan now. This was a worldwide pandemic, and vaccinations was very, very key at bringing the rates down. And that was a public health policy decision. Whether it be national lockdowns during COVID, that was a policy decision, very much at the early phase, in March 2020, when we didn't have any vaccinations, and we had to think of, a very severe, interventions, to curb, the transmission of COVID-19 virus. Whether it be the sugar levy tax, to reduce, childhood obesity. Now if you want to get a can of Coke, that is full fat, it costs you a little bit more as compared to if you want to get a Diet Coke. That was a policy decision, that was an intervention, that was an action, that was a decision, that was a plan that was made, to address the health of a nation. And we'll get into a little bit more in terms of the nuances of public health and health policy. Or whether it be pertaining to our workforce. I don't know if any of you have watched the latest series, This Is Going to Hurt, based on the bestseller This Is Going to Hurt by Adam Kay, essentially exploring the challenges of being a junior doctor within the NHS. And a number of the challenges we face is a workforce shortage. We know that by 2030, there's going to be a shortage of around 30 million healthcare workers. So there's a number of policies we've put into place at a national level and at an international level to try and address this. So once again, more than happy to take any questions of any of these things that potentially are of interest to you, whether you want to get involved with, these different areas, or whether there's health policies that interest you in your own vicinity, locally, nationally, internationally. Let's have a conversation about that. So health in all policies essentially is a drive now internationally that we're seeing. Essentially, it was initially driven by CDC, which is the public health agency in the US. And essentially, it was a drive to actually understand that, yes, there are health policies that overtly address our health. And that will include all of the various things and areas that I've discussed earlier pertaining to sugar tax or pertaining to vaccinations. But essentially, this was a drive to actually remember that almost in every single sector, the policies and the decisions and the actions that are made there will have an impact on the health of a nation, whether it be nationally, whether it be locally. And essentially, the drive was actually to get people and policymakers in different sectors to ensure that health is considered in all policies. And now we're seeing this drive internationally. What does this mean? It means that actually we know that if we have a good transport system, we know that people are better able to get, to access, their appointments, their healthcare appointments. We know if we have a better housing sector, if we reduce homelessness, we know that we can significantly address the health and improve the health of a nation. So these are really, really important things to consider. So at this point, you're probably thinking, okay, Jacob, that's really, really interesting. How do I get involved in health policy making? All of the things that you've done are really, really interesting. I would love to also make an impact beyond the patient. I don't just want to see patients for the rest of my career. I want to have commitments and roles and responsibilities that sees change being made at a wider scale. And this is a framework that I have adopted. And essentially, in today, I'm not going to be going into the specifics and technical bits of what does health policy mean, or, essentially giving you a master's grade within a whole hour. But hopefully what I can give is an introduction, a whetting of appetite as to what this looks like in 2022 to be passionate and to be involved in health policy. So to get involved in health policy as well as in leadership, this is the framework that I would often recommend. So think problems, think solutions, and think contributions. Think problems, think solutions, and think contributions. So what do I mean by this? Think problems. If you are thinking problems, it means that you are having an understanding that, firstly, before we talk about who you want to be in life, or what positions you want to have in life, whether you want to be a chief medical officer, whether you want to be a chief executive officer, whether you want to be a lead consultant or a professor, what should guide you is the problems that interest you. So think about the problems that you are facing, whether it be at a local level. It could be simply, in my work at the Medical Students Committee, when I was at the BMA, it could be simply problems such as, the removal of educational achievements, which created such a upheaval within the Medical Students Committee. So what problems are you seeing in your context? What problems are you seeing nationally? What problems are you seeing internationally? Think about that. And then think about the solutions that are already being posed. Think about the solutions that are already being implemented. Think about, for example, if you're really, really interested in childhood poverty, or you're really, really interested in child trafficking, for example, think about what solutions are actually happening at the moment. Because the reality is that to get involved in health policy, we need to have a collaborative understanding. We need to have a teamwork understanding, and that there is not one person who's going to come and save the day. COVID-19 was a perfect example of that. We had different policymakers. There was no one person who was able to say, this is what we're going to do, and then change the whole narrative. So think about the solutions that are already being proposed. Think about the solutions that are already being thought about. And then when you thought about the solutions, think about your contributions. How can you contribute today? Today, a contribution could be writing a think piece. It could be simply writing a blog. Today, a contribution could be conducting an audit. Today, a contribution could be getting involved in a research project. You may not necessarily be the person that's leading the research project, but seizing opportunities to, whether it be to gather the data, or whether it to be to analyze the data and then submit the data into a larger, database. All of these things will whet your appetite and get you thinking about aspects and problems and solutions that go well beyond, cytokines and, symptoms and signs. This goes to the actual context, the system, that the patient finds themselves. And for me, this is where I think I can make the most impact. For me personally, this is where I think I can affect the most change. And, that's going to be different for different people. But if you're thinking problems, you're thinking solutions, and you're thinking contributions, then I think you've got yourself in the right position. Cool. So we've talked a little bit about health policy. And now we're going to talk a little bit about leadership. And then hopefully you're still with me. This is very interesting because I can't see everyone, but hopefully by the end, everyone's still here, and I've not just been talking to myself for this time. So leadership. So Craig Rochelle is a massive, massive leadership inspiration of mine. And he said a leader is someone who can harness human energy to drive change. Harnessing human energy to drive change. And essentially what I just want to say today is that leadership is going to be focused in every single area that you go into. Every single person who is a doctor, every single person who's a healthcare professional has a leadership, capacity in their right. So I would actually just get us to actually think about and rethink what does it actually mean to be a leader. And a leader is someone who can drive change through getting people behind the vision and harnessing that human energy. So how can you kind of kick off your leadership journey? And for me, I think kicking off your leadership journey starts with your understanding of yourself. Starts with your understanding of what does it mean to be me. How am I built? How am I wired? And if you haven't done a Myers-Briggs or any other psychometric sort of personality test, I really actually encourage you to start there. That's not to say that you're fit in the box of being an introvert or extrovert, but that's to say that the best way you can start on your leadership journey is by leading yourself. And a great, great article is a very, very short article, and it's for free in the BMJ Leader journal, is Your Leadership Style, Why Understanding Yourself Matters. And this is really, really cool document, essentially a cool publication that really just expands and explores the actual importance of understanding yourself before you kind of set out on your leadership journey. And parallel to you leading others, you need to continue to understand what it means to lead yourself. And then also goes into like different leadership styles, how this facilitates a good leadership climate. And once again, these are things that we can talk about, but essentially she talks about, they talk about visionary leaders, those who can mobilize people towards a vision, coaching, those who can really target, individuals within the team and improve their performance, affiliative, which builds emotional connections, you know, and democratic leadership, which tries to build a consensus. And within your leadership style, whether you are at a medical school that does PBL type learning, you know, or whether you are leading a society, you know, maybe have a think about that. Am I a visionary leader? Can I give people a vision and get them behind it? Or do I like to coach people? Or do I like to do all of these things? Or do I create, you know, a more negative organizational climate? You know, am I more of a pace setter where I'm just like, do what I say, like do what I do now and just do it? Or am I commanding, you know? And there is a place for those things, you know, but that should never be our predominant leadership voice. So this is a really, really good place to start. If you're thinking about, okay, how is it I can develop myself as a leader? I would say take time to understand yourself. Other things you can look into, these are more technical things, but I won't go into it, are, you know, the types of authority. You know, and Weber, he's a philosopher, and he has a lot of work in terms of what does it look like to have authority in context. And he describes 3 different types of authority: traditional, charismatic, as well as legal rational. And once again, we can just kind of go into that later on. But yeah, this is just more of an overview in terms of the technical aspects of leadership and how to kind of flesh this out, and happy to give more resources at the end if this is something that you'll be interested in. So who is your favorite healthcare leader? When we get into the conversation at the end, I would love to hear, you know, who inspires you in healthcare. You know, who is it that you look up to in healthcare? And for me personally, you know, Professor Chris Whitty has been absolutely amazing during the whole pandemic. You know, he's someone that has, you know, not necessarily being the most charismatic leader, but he's someone that definitely relies, you know, very much on his technical skills. You know, he's a very, very well-abled technical public health practitioner. He's got a lot of epidemiology understanding and insights that he's been able to build for a long time in some of the world's leading institutions, such as the London School of Hygiene and Tropical Medicine. And this is someone that has definitely, you know, captured hearts, not because of his ability to articulate vision, but mainly because of his ability to stand on like technical grounds and technical understandings. So that's really, really interesting. That's something that we can also unpack later. So once again, we come back to the framework, and I'm closing up now. How do you kick off your leadership journey? It comes back to that framework of thinking problems, thinking solutions, and thinking contributions. You know, understand yourself and look inwards to figure out, okay, what are the problems that make me angry? What are the problems that make me annoyed? What are the problems that I'm passionate about seeing a solution to? For you, it could be climate change. It could be climate change in the context of the NHS. I have a number of colleagues who are really sitting down and thinking about how is it that we can make the NHS more green, more sustainable. For you, it could be, you know, in context of, you know, sexual and reproductive health, you know, and promoting better access, you know, to these products. You know, so how is it that we can think about these solutions, and what can my contribution be, and how is it that I can drive people? Remember, we talked about, you know, being a visionary, you know, or being affiliative, or being a democratic leader. You know, and go on that journey and understand what sort of authority can I lean from, and what sort of leadership style can I develop. And we can talk a little bit more as well in terms of what that could look like. So to close, health policy, leadership very much overlapped. You know, if you are wanting to be any form of person who is able to drive change at policy level, at systems level, and organization level, you have to be a good leader. You have to be someone who can lead others. You have to be someone who can harness human energy and drive the change that you are wanting to see. And I've put a third box here because, you know, the reality is that you may not just want to be operating in public health policy. You know, you may want to be more interested in your own specialty that you're wanting to go into, but simply being interested, you know, in health policy or public health doesn't mean that you can't, you know, if you're interested in other things beyond public health, doesn't mean you can't get involved in health policy, shall I say. You know, if you're wanting to do orthopedics, if you're wanting to be a general surgeon, you know, you can get to the heights of, you know, orthopedic surgery and then get involved with the policy direction, of the Royal College of Surgeons or the British Society of Orthopedic Surgeons, So there is really scope for this third box to be whatever you want it to be. You by no means have to operate in public health to influence health policy. If you're interested in dermatology and you want to promote, better access, to skincare products for people from low income backgrounds, we have a number of consultants who are doing this. And this requires you to be a good leader. This requires you to have an insight to how to drive change at policy level. So yeah, that box can be whatever you want it to be. So I would encourage you to have a think about that. And I'll encourage you to think about what leadership means for you. So that's all that I have for you today.